Before having a contact with the patient, always observe proper hand hygiene to prevent the spread of harmful microorganisms.
Okay, so first we're going to provide privacy.
Greet the patient and introduce yourself.
Good morning, ma'am. I am Celica Ompad, your student nurse for today. So today we are going to have a Leopold's maneuver in order to identify the position and the presentation of your baby. So before that, may I know your complete name, ma'am? Okay, so how about your date of birth? Okay, thank you, ma'am. So before anything else, Mrs. Piglet, I am going to explain the procedures to you first and the corresponding steps. So the first maneuver, Mrs. Piglet, will help us identify if your baby is in cephalic or breech position. In breech position, your baby's buttocks or feet comes first, while in cephalic position, the head of your baby comes first. So for the second maneuver, ma'am, it will help us identify where your baby's back is and including its small parts such as its arms and its legs. It will also help us identify the fetal heart tone once we find the baby's back. And for the third maneuver, Mrs. Piglet, it will help us determine the mobility of the presenting part. Fourth maneuver, Mrs. Piglet, it will help us identify whether the baby's head is engaged or not. So we have to empty your bladder first, Mrs. Piglet. Now, let us put you in dorsal recombinant position so that it will be easy for us to assess your baby. Okay. So let me put the back of your head first, ma'am. So are you comfortable with that position? Okay. So Mrs. Piglet, in this maneuver, I would need to touch your belly. So is that okay for you? Okay, ma'am. Okay, let's just open this.
Now we have to warm the hands by rubbing it together because cold hands can stimulate uterine contractions.
Using the centimeter of the measuring tape, we are going to measure the fundal height starting from the symphysis pubis to the uterine fundus of the mother. So it's around 25 centimeters, which means that the baby is in 25 weeks. First step, we are going to form a triangle and locate the fundus of the mother. First, let's determine what part of the baby's body is in the upper fundus. So if you feel like it's round, it's hard, and it moves independently, so that's the head of the baby. But if it's soft and tiny, and if it moves with the body, so that is the buttocks of the baby. Okay, so for the second step, we are going to place both hands in the sides. This will help us determine the fetal back or where the baby's back is. First, with the first hand downwards and the other. So we are going to identify the long axis. This back should be flat and long. So in this way, it will help us identify where to put the heart rate monitor so that we can monitor the baby's heartbeat. Moving on the third step, we are going to determine if the baby's head is engaged. So we're going to form an L using the fingers. So if we cannot lift the baby's head, that means the baby is engaged. But if we can lift and move the baby's head, that means the baby is not engaged. So now for the last step, we are going to face on the mother's feet, facing there. So we're going to start on the bottom and place it to feel it up. This is to confirm the position of the baby. Okay, so that's it. So let's cover the mom. Okay, so we're done, Mrs. Piglet. And make sure that the mom feels comfortable. So are you okay now? How do you feel now, Mrs. Piglet? Okay, so you're fine. Okay, so don't forget to document significant data of the patient.